When recovering from an injury or a medical condition, there is no better place to do so than your own home. And here to tell us what Home Rehab Express can do for you or a loved one is Joanne Ellis once again with Home Rehab Express and Dr. Mark Farmer with Orthopedic Center of Florida. Good morning. Welcome back, guys.
Good morning.
So talk about it. It says it in the name, Home Rehab Express, but how do you describe what Home Rehab Express is?
Home Rehab Express is a home health company, and we send nurses and therapists to patients' houses who are unable to make it to the doctor's appointment for either follow-up appointments or continued physical therapy that may be more intense than they would be able to do on their own.
And again, kind of the treatment and the different injuries and medical conditions that you guys are helping with are endless. So I know you meet a lot of different doctors across the area. Dr. Farmer is one of them. We're going to talk this morning about osteoporosis, and women, this is particularly interesting, I think, for them because we're kind of more at risk for osteoporosis. Is that right?
Yes, you are. Osteoporosis is essentially a disease of bones where the bones get weaker as we age. And unfortunately, because women start off with bone that's less dense when they're 30 compared to men, as they get older, the bones get weaker or at the same rate, but they have less bone to start with. So unfortunately, when you have osteoporosis, you have an increased fracture rate. So you can fall and break your hip, your wrist, sometimes your shoulder, and also compression fractures in the spine.
Which kind of makes sense. At what age did you say this starts to? I mean,
well, we really start to test in people who have risk factors at about 50. So risk factors include smoking, various medications that some people take, low exercise rate, so they're not getting the exercise.
So maybe some prevention. I mean, is that some things that you can start doing now to maybe
There is, and
prevent?
Also, unfortunately, there's a large genetic component to it as well. So if you have a family history of it, your likelihood is that you're going to end up with some form of osteoporosis too. And there are medications that we can use to treat it in addition to calcium and vitamin D, which are really important as a baseline. But now, more and more, we can reduce your fracture rate somewhere between 40 and 80%, depending on which medicine we use. And there are some which you can take by mouth, and there are some which are injectable. The injectable ones tend to have a better success rate, though.
Very interesting. Well, doctor, thank you so much. Joanne, if anybody wants to find out more, certainly find out more about what you guys are able to do, what would you suggest they do?
I suggest they go to our website, which is homerehabexpress.com, or call the number that is on the screen.
Easy enough. Joanne, thank you so much. Doctor, thank you so much for being here. We appreciate it. And of course,